Today I am reading from the book Spirit of Homeopathy, Philosophy Part, Chapter number 17, Selection of Potency. In homeopathy, the selection of potency has been much debated question. Many of the ideas are empirical and from these rules have been framed. In this chapter, we will examine the basis of potency selection and through logic try to formulate some rules. Basis of potency selection. We have to go back to the understanding of the disease. Disease consists of two distinct parts, central disturbance and peripheral disturbance. By central disturbance, we mean the general adaptation of the person which precedes the localization of the disturbance. This adaptation of the whole being to a particular stress then extend to the part and organ of the body, producing the local disturbance that we can call pathology. In understanding the dynamic of disease, we have to understand that the organism tries as much as possible to keep the disturbance restricted to the center and to allow it to produce localized changes. This phenomenon can be seen very well in the children when they have intense mental symptoms such as restlessness, irritability, obstinacy or jealousy, but the local changes are very minimal. So in most children you have a very intense central disturbance and very little local pathology. Why does this happen? Let us consider the opposite state. In old people we do not find such an intense central disturbance. Instead, we see very severe local pathology. You see cancer, hypertension and so forth, but very little central disturbance, namely very few mental and general symptoms. This phenomenon can be explained by stating that the central disturbance belongs to the whole being and it affects all the organ system in the functional way, so that the heart beat faster, the respiration become rapid, the blood pressure increase, etc. When the vital organ like the heart, lungs or liver cannot bear the intensity of the disturbance, then the organism will keep the level of the central disturbance to the point where it can be borne by the vital organ without any adverse effect. For example, when the stress of the microorganism like bacteria affects the system, the first response is a generalized one. There may be loss of appetite, malaise, weakness, aversion to being disturbed and high temperature. When the temperature reaches up to the 104 or 105 or 106, then vital organ like the heart cannot work fast and the high temperature itself can damage the organism. So the central disturbance is restricted at that level. The temperature is not allowed to rise and the disturbance is diverted to some local parts such as lungs, kidney or joint and producing the example of pneumonia, glomerulonephritis or the arthritis respectively. So the level of central disturbance is determined by the amount of stress the vital organ of the body can tolerate at the particular time. When we understand this, then it becomes simpler to understand that in the children, where the vital organs are in a good shape, where the heart can bear a lot of stress, where the lung can breathe much faster and where the body can stand much higher temperature, the vital force can afford to keep the central disturbance at a very high level and the local disturbance at a low level. That is why we see many mental and general symptoms in the children are very fewer or local ones. Its general symptoms in children are very fewer local ones. Application of the idea. The potency means power of the medicine consists in its ability to produce a central disturbance. The higher the potency, the more intense the central disturbance it can produce. So, when we select the potency, we have to select it at the level which is just above the level of the central disturbance of the person at that time. If the potency selected is much lower, then it will have very little effect and therefore have to be repeated quite frequently. If the potency selection is much higher, then it may produce a level of disturbance greater than the one the body currently has. Since the level of disturbance of the body may be just the one the organ can tolerate. Producing a much higher disturbance could lead to a bad aggravation and may be harmful. Therefore, the selection of potency has to be based on the intensity of the central disturbance, which is represented by the mantle and generals. The intensity of the mantles and generals is seen by extent of clarity of their expression. If the mantles and generals are clear and intense, then the potency has to be higher if you want a quick response, right? I have heard that if there is a gross pathology, we cannot give a high potency. Many people advocate this as a cautionary rules. I do not subscribe to such rules. If the central disturbance is high, it means that the organs are in a position to tolerate the high potency. Therefore, if you give a high potency in such a case, it would not be harmful even if the pathology is more marked. Based on this understanding, I have given a high potency in cases with a very severe pathology without noticing any aggravation of the pathology. Of course, in these cases, the mantles and generals were quite marked. However, in case of doubt, it may be better to start with the potency that is just one step lower than the one we actually want to give, and then increase it later after we have seen the effect. Under the label potency and the delusion, we have already seen that the higher potency produce a more intense central disturbance. Example, more intense mental and general disturbance. When such intense mental and generals are produced, the delusion becomes quite specific and marked. So, when we talk about the 68, 6 potency, 38, 200, 1M, 10M, 50M potency, what happening? If we look at the remedy, say nitric acid, we see that it has anxiety about the health and malaise, anger, irritability, hatred of the person who offend, unmoved by the apology. All this comes from the situation of a person who is fighting a court battle or someone who is having long-standing feud and whose survival depends upon the being obstinate, hateful and malicious and unresponsive to any apology. In low potency, nitric acid produces anxiety in the prover. This is unassociated with anxiety, free-floating anxiety with some irritability. When we go to the 30th potency, the anxiety becomes a little more specific. He feels anxiety about himself and some hatred appears. In the 200 potency, the anxiety about the health becomes a little more marked. As we go higher, say 10,000, it become clear to him that he has hatred for person who offended and he unmoved by the apology. Means on the basis of the mental levels, you can increase the potency, intensity of the disease. As we go higher of 50th potency, the delusion that is fighting, I am repeating the same sentence. As we go higher on the 50th 50,000 potency, the delusion that he is fighting and court battle that is engaged in a long-standing war in which he cannot yield came to him quite clearly. So one can say, as potency increased, the delusion become clear and the original situation of the state is more clearly revealed. Now, under the label application, when the remedy we select for the patient is not well indicated, when the picture is not clear, or when you prescribe on something broad like a general anxiety and irritability, it is necessary to give a low potency of the drug repeatedly and hope for some changes, as the selected medicine will produce a state of the undefinite anxiety and irritability. Right, as the person's mental state become clear and clear, and we feel sure that the remedy is well indicated and we are even able to find the exact delusion, then we go to the higher potency immediately, provided or high potency immediately, provided of a course that the central disturbance is intense. However, if the central disturbance is intense but the remedy found is not exactly one, we have to use low potency, because the higher potency of the non-indicated remedy will not touch the cases. If, for example, the man who has the state of nitric acid with the delusion of cot betel, this is the specific delusion, is given a remedy like a lycopodium, which also has anxiety and irritability, then you give it in the 30th or 6th potency. If you give him lycopodium 10 and 50 it will not produce a specific delusion that he does not have the capacity to reach this goal. And so he will reject the straightway. His system will just reject the lycopodium 10 because it is producing an exact message in the delusion that he does not have the capacity to reach this goal. And when such an exact message is given and this is not this message inside the patient, it will be rejected. If you give lycopodium 30 or the 6th, however, he will feel okay in his anxiety and irritability. This message is accepted because it is not specific. As the indication become more and more specific, you can go higher and higher in the potency. But if your remedy selection is very broad based, then you have to use in a lower potency. This probably is the reason why the biochemical remedies are prescribed in the low potency, even the decimal potency, as there are only 12 of these remedies. They cannot be specific. The effect is going to be very broad based, and so the lower potency 4 times a day has some effect. Now, under the label change of potency, after giving the indicated remedy for a few months in the chronic cases or a few days in acute cases, sometime even a few hours, we are able to bring out about the change in the condition of the patient body itself, where the vitality is increased on the body and vitality is increased. The body is now able to tolerate the higher central disturbance than the one it was able to before treatment. The level of the central disturbance goes up fractions with every amelioration or peripheral pathology. In this case, in this chronic crisis, therefore, my experience has shown that after 6-7 months or sometime after 1 or 2 years, the same potency does not hold good any longer, and I have to increase it by time. This means that the level of central disturbance which can be tolerated has now risen. Usually, in 1 or 2 years, we find that the peripheral pathology has regressed considerably. Now, under the label, the risk in local prescribing. We can prescribe on the local symptom and local modalities. For example, person has a calcea carbonica constitution but has joint pain with the modalities of Rustox. Example, worse by fast motion, better by continuous movement, better by heat, etc. These are common symptoms of the joint problem. They are pathological symptom and not symptom of the central disturbance being expressed locally. In this case, if we give Rustox in any potency, especially high one, there will be hardly be any effect on the whole person because it does not match the whole person, but it will an effect on the joint because it has a modality of toxicodendron. It produces therefore local homeopathic effect. By ameliorating the joint, it will relieve the patients temporarily, but it is harmful in the long run because if we keep repeating the Rustox, we find no amelioration in the mental and general, which shows it is not the remedy for the patient. Even this effect on the joints temporarily better, and therefore frequent repetition will be needed. As you keep on ameliorating the joint with a high potency, the body has no choice but to take a joint problem and push it into the deeper organ or the system of the body. We have seen that the organism try to keep disease in the least important organ, but if we do not allow the disturbance to localize there, it has no choice but to push it more important organ because it cannot afford to increase the level of central disturbance. By pushing it into more important organ, we are causing suppression. So if you keep on repeating the higher potency for a long period of the time based on the local modality, the result will be suppression. To summarize from above rules of the potency selection, the higher central disturbance, the higher potency. The clearer the mental and general, the higher the potency. The closer we get the exact remedy of the patient, the higher the potency call for the case. Now under the label, a small controversy. When in my seminar, I suggest that after treatment, the central disturbance may increase in the level, with reduction of the peripheral pathology. The listeners are confused. The confusion is that according to Haring's law of direction of the cure proceeds from the center to periphery, and it was seen in suggesting that in the process of cure, the direction is from periphery to the center. I wish to remove this confusion. There is no contradiction between my ideas and Haring's law. In fact, my ideas based upon Haring's law. Let us understanding the Haring's law first. It states that in cure, the disease travel from more to less important organ, from the above downward, from within outward, and the reverse order of the appearance. Haring's here refer to the pathology. When disease comes, the central disturbance occurs first. Haring did not mean that the initial you will get an affection of the little finger and then it will start producing mental symptom. He meant that the central disturbance occur first and the body tries to keep pathology at peripheral level. The body first tries to keep disease at the level of the finger joint, then at the level of the lung, and then at the level of the heart. This is the direction of the disease in pathology. The central disturbance is the initially, and then because the central disturbance cannot tolerate the stress anymore. Example, the level is increased beyond the endurance. It localizes the effect in joint and then spread to the lungs and then localize in the heart. When cure takes place, disease takes the reverse order. First it will leave the heart, then the lungs, and then joint. This is what Haring means. It is unfortunate that Haring's words about the progress of the pathology have been understood wrongly as applying to the entire affection of the organism. Masters like Stuart Close and H.A. Robert have emphasized that functional disorder precedes the development of the pathology. Does this mean that the central disturbance means function of the mind and body are first disorder and then follow disorder of the body means periphery? Haring's laws explain development at the point. Disease always proceeds from the central disturbance to the periphery in pathology. It proceeds from the periphery towards the central. This is the idea. It is the curative direction. Disease first abates from an important organ that is affected pathological, and the last disorder to go will be that of the least important organ affected. Only then will the central disturbance be relieved. When you are a patient of lycopodium, you have the patient of lycopodium, he will first have lack of confidence. Example, the central disturbance cannot be contained, he will develop a eczema or asthma. When cure takes place, his asthma will go first and eczema second, but lack of confidence will be there throughout. If lack of confidence goes, then there is no basis for the eczema or asthma. Without the central disturbance, there cannot be peripheral pathology developed, because peripheral pathology is only diverse from the central disturbance. Now, as the level of health improves, the body becomes enough to tolerate the greater central disturbance. This takes place over a long period of time, but they tolerate a great central disturbance. It is not that I give him lycopodium and the eczema disappear and his lack of confidence increase. This does not happen. If the asthma disappear, his level of lack of confidence remains the same. And when the eczema disappear, his level of lack of confidence also remains the same. How do we know? Because the same potency is working, the same potency is effective, and at a certain point the potency stops working and higher potency is required. This shows that the central disturbance has gone up, and when it's happened, it means that the body has become stronger and it can tolerate better. This does not take place immediately in a chronic cases, but over a period of 1.5 years. In acute cases, it will take place more quickly. The weakness of the system gradually reduces, and its ability to tolerate the central disturbance is improved. You can then give higher potency, means 1 m or 10 m. Within a few days, you can increase the potency because the system gets stronger more quickly in acute conditions. It is like water is a reservoir which is marked with a danger level. The water should not rise above the danger level. Otherwise, the surrounding important structures will be flooded up. Hence, when water comes to that level, a little water is diverted to the less important area, somewhere in the periphery, and then when the area gets full, a somewhat more important organ is filled up with the water. But when the danger marks is raised, then can be more water in the reservoir. There can be more water in the reservoir, right? Difference between the crude and potency. Now under label difference between the crude and potency. The crude remedies produce peripheral disturbance and the potentized remedy produces a central disturbance. The mental symptoms that are produced by the crude remedies are either direct effect on the brain as caused by hallucinations like opium, etc., or the generalized non-specific mental agitations or dullness as a result of physical distress or weakness caused by the drug in its toxic form. The crude remedy has very little dynamic effect and most of its effect are nothing but local toxic effect, the sum total or which resembles a general disturbance. A potentized remedy on the other hand has no local effect. Its action is seen in the form of delusion of situations both physically and mentally. We can therefore understand that the crude dose of arsenic will produce local effect like diarrhea, gastritis, change in the skin, hair, etc., with restlessness, agitation in the mind, and irritation of the nervous system. Potentized arsenic, however, would produce a delusion of something, situation in which there is fear of death, fastidiousness, and thirst, etc. The higher the potency, the clearer the delusion. In sensitive person, a delusion is followed by generalized disturbance and later by local effect. Those who are not sensitive to the delusion, means who for some reason are non-reactive to such suggestion, will not show any reaction from a potentized drug, whereas one will react to toxic or crude drugs because the crude dose is a direct assault on the local part and is not dependent for the effect on producing the delusion. Therefore, even in a crude form, a drug can only make the pathology worse. The potentized drugs, on the other hand, does not usually produce any damage if given in a single dose, since it is just like asking a person to imagine a situation. Unless the picture is so horrid and person too fragile, such an imagination cannot cause harm if given only once.